So I'm going to ask you a few questions on the different types of vitamin D. So we know that the type that we get from the sun is created via the UVB lights with cholesterol in our skin. And then we can supplement with vitamin D3. And we also know that there's certain foods like medicinal mushrooms, different things that can store, or sorry, that have vitamin D2. So can you tell me why you want to use D3, maybe why D2 is important, or if you think that's important? Let me know your opinion on the differences between the different forms of vitamins.
Sure. So first of all, it's a misconception that people have about cholesterol in your skin.
Mm.
So it's the precursor of cholesterol, 7-dehydrocholesterol, that absorbs ultraviolet B radiation in the sun, making pre-vitamin D, which then thermally isomerizes the vitamin D in your skin. And so it turns out that most vertebrates are exposed to sunlight. They make vitamin D3, right? And it turns out that the first vitamin that was discovered was vitamin D2, and that was back in the 1930s when they started irradiating yeast and finding anti-rachitic activity, which was really important because back at the turn of the last century, in around the early 1900s, upwards of 80 to 90% of children throughout Europe and northeastern United States had evidence of rickets. And so the concept of initially adding ergosterol, the precursor that's found in yeast, to milk and irradiating it to give it anti-rachitic activity, ultimately irradiating yeast and making vitamin D2, that was a major breakthrough in helping to maintain good bone health in children and prevent rickets. So vitamin D2 had been used for more than 50 years as the major vitamin D supplement. And then some publications came out to imply that maybe vitamin D2 is not as effective, but more importantly, there was a suggestion that if you ingested vitamin D2, it actually increased the destruction of vitamin D3 and therefore could potentially make you more vitamin D deficient. Well, when I read these publications, I had no reason to doubt them, but I decided to do our own research. So we've done now at least 3 studies looking at vitamin D2 and the maintenance of vitamin D status. In the United States, the only pharmaceutical form of vitamin D is vitamin D2 because it predated the FDA. There is no pharmaceutical form of vitamin D3. Lots of supplements, but no pharmaceutical. So when we treat our patients, at least my patients, I give them 50,000 units of vitamin D2, and I give it once a week for 8 weeks to fill up the empty vitamin D tank. And then I put them on 50,000 units every 2 weeks forever to prevent recurrence of vitamin D deficiency. So you can also do the same thing with 50,000 units of vitamin D3 as a supplement. But in my opinion, the supplement, you have no idea who the manufacturer is. You don't know what the quality is. But for the pharmaceutical, we do know. And so that's the reason I use it in my clinic. We've done studies and showed if you give the physiologic doses of vitamin D2 and vitamin D3, you will raise the blood levels of 25-hydroxy vitamin D to the same degree. But more importantly, the question that should be asked, do your kidneys recognize then 25-hydroxy vitamin D2 as efficiently? And the answer is yes. We did a study, and we showed that when you put a person on vitamin D2, it's the major substrate. And so as a result, it's converted to 25-hydroxy vitamin D2, goes to the kidney, and is converted to 125-dihydroxy vitamin D2. And what we found was that, as you would have anticipated, is that the 125 D3 levels go down, the 125 D2 levels go up, so the total amount remains the same. So whether you're on vitamin D2 or vitamin D3, you can maintain vitamin D status and the active form of vitamin D. So from my perspective, vitamin D2 is as effective as vitamin D3, and I use it all the time in my clinic.